Good evening, it is 7:40 p.m. in Ulaanbaatar, Mongolia. Welcome to Today interview time. Today I have Dr. Abhideep Chaudhary and Mr. Pradeep Rishi in our studio. Dr. Abhideep Chaudhary is a liver transplant surgeon from Jaypee Hospital in India. He's an American trained surgeon and has done more than 1,250 liver-related operations throughout his career. On the other hand, Mr. Pradeep Rishi is the head of marketing and strategy at Medzul Medical Company. Good evening, gentlemen.
Good evening.
Sir. Thank you for receiving our invitation.
Thanks for inviting us.
So what are the main causes for liver diseases and when do person goes to the liver transplantation?
So overall, if we talk about worldwide, there are various causes of liver disease. The most common causes are alcohol-related liver disease, liver disease secondary to viral hepatitis like hepatitis B, C and D. Then there is fatty liver-associated liver disease. Then there are certain other causes like autoimmune, where body starts to reject its own organs. And then there are certain diseases like bile duct deformities and certain diseases where there is enzyme deficiencies in the liver. But now
enzyme means this is sugar.
No. Enzyme is there are certain kind of metabolic diseases where people are born without certain enzymes which are important for the metabolism of the body, and if it is not done properly can lead to multi-organ failure. Now specifically talking about Mongolia, the most common reason of liver disease in Mongolia is viral hepatitis, which is secondary to hepatitis B, C. And people of hepatitis B have also hepatitis D, which is again very specific to this region. And the second most common is alcohol, and third most common is fatty liver associated liver disease.
And what causes the fatty liver?
So what happens is liver starts to accumulate fat in the liver, which is secondary to various causes. People who take a lot of fat in their diet, who are obese, overweight, have metabolic syndromes, diabetes, and if they take alcohol as well, they all lead to accumulation of fat in the liver. So what happens is the liver cells are replaced by the fat, and the fat oxidation happens and rest of the liver cells start to die, and that leads to chronic liver disease and liver related problems. So in terms of the incidence, if we talk about liver disease is pretty important in Mongolian scenario because it's the second most common cause of death in Mongolia. So and again the most common cause of cancer in Mongolia. So and it is all because of these viral infections and overall disease burden in this country.
So when exactly the patient do need to go for a liver transplantation? So how do you know that?
So initial part of liver disease can be managed medically, but once the liver starts to decompensate, by the word decompensate I mean if someone starts to have water collecting in the belly, someone starts to have a bleeding in GI tract, which leads to vomiting of blood, or effect on the brain, or start to have very poor quality of life, or start to have effect on the kidneys, that's the time they should go for liver transplant.
Right. So my next question is from Mr. Rishi. So why do liver patients need to go to India? What's the benefit of Indian medical care system?
Yeah, Indian medical system is very advanced at this moment of time, and India is among the top 3 destinations for which people are going for treatments. Indian doctors and equipments both are at an advanced stage. The doctors are having very quality doctors we have. Everybody is experienced and have been for 5 years to 10 years in America or Europe, and they have returned. The equipment is also state of art because we get equipments all over from the best equipment which we can get from the world. Why India can also give at an economical rate also. The point is that we have a lot of a huge population, right? Like Mongolia is a small population. So the equipment we buy at a higher rate also, it becomes business viable for us because we treat 1 lakh people or 1 crore people. In Mongolia, you may be having only 10 or 1,000 people. So it becomes business viable for us. So the treatment also, what you get in US, it is at a 90% less in India.
90%?
less.
You're saying 90?
90.
Cheaper
than US.
Wow.
And even 60 to 70% cheaper than Singapore or Korea.
Right. Because I know lots of people from Mongolia go to any kind of medical treatment to Korea. I often heard about people going to Korea. But
yes, but India, it will be almost 1/3 the cost of Korea.
Much cheaper.
Much cheaper. So
there's another point I would want to add in this one. There is government initiatives as well. Government has kept a capping on which the drugs or the equipment can be sold. So that also has brought down the price significantly. The same pharmaceutical company which is producing the medicine and which has been sold in various parts of the world, there is a capping at which the maximum price at which that medicine can be sold, and which has actually brought down the cost significantly. And most of the companies, multinational companies, American brands, they have put up their plants in India for manufacturing these equipments as well. So that also contributes to a significant reduction in the prices.
So what's the advancement of liver transplantation in India? And when you think about the transplantation, you give, let's say I am a donor and I give my liver, what happens to me?
Right.
That's very interesting question. Yes, because I need to worry about myself at the same time.
Absolutely, absolutely. So donor selection is pretty stringent in terms of how we do it. We have a very strict criteria on the basis of which we select people who can donate part of their liver. The beauty about liver is it regenerates back. So you can remove up to 75% of the liver, and then if you check in next 6 weeks, the entire liver is back. So,
so it regenerates itself. That's quite fast, 6 weeks.
That is the reason we are able to do this kind of surgeries. And we select those donors who do not have any problem otherwise, who have a very healthy liver, good sized liver, which can be split easily and can be implanted in the patient, and the remnant is adequate for the donor. So the donor goes through a detailed evaluation before that person is accepted as a final donor. So that there is no effect on the current as well as the future life of the donor. Only when we are just satisfied, and this is not done by one person, it is done by a big team, which includes the surgeon, the hepatologist, anesthetist, cardiologist, chest physician, endocrine person, gynecologist if it's the female donor, and then an independent medical board evaluates the entire evaluation process and makes sure that only a healthy person is accepted as a donor.
Right. So, one funny thought just struck my mind. Indian person's liver and Mongolian person's liver, are they any different?
So
I mean, it's just, I started thinking about the weather condition and, what they eat, and is there any difference?
It is like not Indian or Mongolian, but what difference is if a person is vegetarian or a non-vegetarian. A vegetarian person, usually what we have seen, has a smaller liver compared to a non-vegetarian. So we get patients from around 40 countries in the world. So people who consume a lot of non-vegetarians have a bigger liver, and they are very comfortable in donating part of the liver.
The big one. So you have big one.
Like people coming from Iraq, Afghanistan, Pakistan, Mongolia, or Uzbekistan, they have bigger liver. Compared to a person who's coming from India, where most of people are vegetarians,
so and smaller liver.
Comparatively smaller liver.
It's an interesting fact, actually. There are so many medical companies in Mongolia, in Ulaanbaatar especially, and what is the advantage of the Medzul?
The first advantage is, like, we are a very old company which have been coming to Mongolia regularly every 3 months, first of all. Then we have translators, Mongolian translators in India.
In India?
In India.
So let's say patient goes to India, you have translators there,
on
the site.
Mongolian on the site. So it is on the roll. So it is not like for 2 days we are keeping it. It is permanently with us. So whenever you have any problem, even if we have liver transplant after 2 years, 3 years, So we are in contact with the Mongolian patients always. We have been treating Mongolian patients in liver transplant, in cancer, in heart diseases, even in the gynae some patients we have taken. So we are not only for like 2-3 patients, we have seen a lot many patients, particularly from Mongolia. And our company starts much before when you come to India. When you are in Mongolia, you can get consultations from us. We consult the doctors and we inform you. And you get the visa services from us.
Oh, right.
Yeah. So it is very easy getting a visa invitation from India. You don't do anything. We do everything for you. When you come to the airport, people are scared where to go, where not to go. So already our cabs are there. We pick up from the airport. We send you to the guest house, whichever guest house you require. People say we require a lower guest house. Some say we higher guest house. So whatever the choice, we provide there.
Specific.
And translators is there. And after we do all the non-medical services, right? So medical treatment is given by the doctor. But after the treatment is given, he's back to Mongolia. Again, he requires some kind of, suggestions from the doctor. Then again, we come into picture. We take
so you don't just lose the guy.
Yeah,
okay, you have your surgery. Bye bye.
Bye bye. It's
No,
not
like
that. Then again, when he needs some assistance, we again assist him. We assist, communicating with the doctor. And I have seen that for the Mongolians particularly, language is very important.
Yes.
So if you are not English speaking or Hindi speaking, if you are Mongolian speaking, you need to have a translator and a person who understand what is the Mongolian mentality and Mongolian language.
Right, exactly.
So that's what we have a USP, the best thing.
So do you guys work with in other countries?
Yeah, presently we are working with 2-3 more countries. We have translators for them, but for Mongolia we have permanent translators.
Right.
Yeah.
So you have worked with Mongolian patients, you have communicated with them. Yeah. So how are Mongolian patients compared to the other patients, and what's your experience with them?
I mean, the problem is the patients are always suffering. So it is like comparing one country patient to another country patient does not make sense. And for my kind of specialty, they are like in their terminal stages, and if the transplant is not done in
terminal stages.
Yeah, it's basically if you don't do the transplant in the next 3-6 months, they're not going to survive. So they are pretty sick people.
From
so
Mongolia.
Yeah, it's not just all the liver patients I'm talking about. And the patients from Mongolia per se, I mean, the families I would say are pretty supportive families. And as I was mentioning about another case some time back, I mean, a person required 2 donors, 2 brothers came forward, and it's kind of pretty good kind of family structure, bonding I see in Mongolia. And there's always people who are supportive and ready to support their family members. That's kind of pretty good. And as far as their overall strength is concerned, they recover much faster.
Recover faster.
Yeah, and but only thing is what people need to understand, transplant is something which needs to be done well in time. If they delay too much trying to look for other alternatives when they need transplant, their overall body fitness start to go down. So and that is something they need to keep in mind. There are a lot of queries that come to us where actually the condition is pretty bad. And
when they're too late to even have transplantation.
Right. So that is something they have to understand, that it should be done well in time, because if it is done well in time, the recovery is much faster.
So I'll just put my last question. How can we prevent from these liver diseases? The prevention is
right.
the ultimate goal of ours, right? For
Absolutely.
everyone. Yeah.
So whenever I come here, we do some liver health sessions as well, and I keep emphasizing on this prevention part. This is pretty close to my heart, and this is not just here. Wherever I go, I just try to work on that according to the needs. There are a lot of vaccines like hepatitis A and hepatitis B can be prevented by vaccine. That is something which I say every person, whatever age, you haven't got that vaccine in childhood, get it. Even if you're 60, 65, 70, just take that vaccine. Because you never know when you're going to get any kind of viral infections.
Right.
So that is, which can be prevented with vaccine, should be done. Second thing is consuming alcohol in appropriate amount. If I start telling people don't consume alcohol, there are a lot of people against me then. So I just want to emphasize that even if you have to consume alcohol, consume it within a limit amount, which is like not more than 1 unit for females and not more than 2 units for men in one day. If you consume alcohol continuously for 5 days, you should take a break from alcohol for a few days so that you
5 days and take a break.
So and
that's harsh, but yeah.
Yeah, but then it
it.
gives chance for liver to regenerate back. Again, having a good quality of life, by that a regular exercise schedule, you should not be overweight, don't consume a lot of oily fatty food, and have a good lifestyle, so that will prevent fatty liver from developing. And if there has been an incidence where you think you might have contacted viral hepatitis, like you had an unprotected sex with a person you don't know, or you had
from unprotected sex you can
acquire hepatitis B or C, and you have been to a person like acupuncture and all, you're not sure about the sterility of those needles. So or you have a family person who has viral hepatitis or a high good family history of liver disease, those patients should get themselves evaluated, because as I said early on, we can treat them easily with medicines. It only becomes a problem when it becomes too late, then you have only option is liver transplant. But 90% of the liver problems can be treated with medicine if diagnosed well in time. So that these are overall, I would want to say, can actually prevent or treat early, which is again equivalent to prevention.
Yes, yes. The main thing is the prevention, right?
Yeah.
Not to get sick.
Absolutely.
In the first place. So let's say I have a person who has liver problems, liver disease. How can they contact with you guys?
We have persons in Mongolia also where you can contact with my company, or you can send directly to medzulhealth@gmail.com. That's our email address, medzulhealth@gmail.com. You send us the query, we'll get it evaluated.
How fast do you reply?
Within 1 week, maximum 2. Maybe if it is Sunday, then obviously then it is 2. Otherwise, like 1 to 2 maximum. 24 hours to 48 hours, we replied back. Whatever evaluation is to be done or surgery is to be done, whatever the best we can get from the doctor. The other point which I wanted to say earlier also, that we are a company, we know about, there are thousands of hospitals in India. We know which hospital is the best and which doctor is the best in that hospital. So that is also our advantage.
Specific knowledge.
We have specific knowledge of India, which doctor to contact for that, which specific disease. So yes.
Right. Well, unfortunately, we have only 20 minutes of time, and thank you for coming here and give our audience and me as well lots of advice on these liver diseases and problems, and also thank you for you coming here to educate our well-educated knowledge sharing going on, right, to Mongolian doctors. And I wish you health and good luck in the future.
Thanks for having us here.
Thank you.
Thank you. My pleasure. Thank you.
And that's all for today. Thank you for being with us. You're watching Today. We will see you on next Tuesday with more news and updates. Have a good one. Bye-bye.